So today we know about orthopedic instruments in NEET PG 2025. The first instruments is bone cutter. This is bone cutter. It is used to cutting bone into small pieces. Here the available with straight and curved ends to cut the bone fragments or fastening in fracture site during fixation. This is bone cutter. Next instrument, this is curved bone cutter, and this is straight bone cutter. So curved and straight, two types of bone cutter. This is osteotome. Osteotome used for cutting the bone. In osteotome, the edge of this instrument beveled, both edge beveled type. And this osteotome available in different widths required where it is used. It is used for cutting bone in different sites. Bone. This is bone curate. This is the bone curate. At the end, spoon type of structure. This is bone curate, and this is the handle. By this instrument used for cutting cavity in the bone or something curate the giant cell tumor or osteochondroma or any benign tumor. This is bone curate to curate the bone. In case of debridement, we can use bone curate to clean the bone or any infected soft tissue or foreign body. This is bone holding forceps. By this forceps, you can see the threads at the holding side to hold the bone properly. It is used to holding the bone. Three types of this bone holding forceps is available: lion toothed, lane holding the femur tibia, or self-retaining AO type. This is also bone holding forceps, and this is the plate holding forceps to hold the plate at the fracture site and stable this, then fixed. So to hold the plate, this is plate holding forceps. So this is the mallet. We all know it is used hammering osteotome, chisel, etc. This is bone awl. By this bone awl, there is a small pointed hole. This is pointed thin instrument for making a hole in the bone during some tough structure or some soft tissue bind with bone. When required soft tissue bind with the bone, this type of bone awl is required. This is the eye. This is an eye. It's tipped to thread a wire through the bone. During tendon transfer also it is used. This is bone awl. This is the bone gauze. Bone gauze. This is a concave blade chisel used for cutting on round bone. On round bone to cut the bone. This is chisel, and this is at the end. This is a concave type of chisel. This is bone gauze. This is K-wire, threaded K-wire and normal K-wire. K-wire used in all purpose of orthopedic surgery. Fix the bone, temporary fixation, all type of cases K-wire used. This is Steinman pin. Steinman pin is a stout steel rod used for skeletal traction. In case of Steinman pin, there is no thread in Steinman pin. K wire, in case of K wire, in two ends, sharp end in two ends. K wire, in case of K wire, the sharp end present in both the ends of the rod. But in case of Steinway pin, one end is sharp but another end is blunt. But in case of Steinman pin, there is no thread. In case of Denham pin, the thread present in the middle. In the middle, Denham pin thread present. In case of Sands pin, the thread present at the tip. So the difference between Steinman pin, Denham pin and Sands pin, Steinman pin, there is no thread. In case of Sands pin, thread at the tip. In case of Denham pin, thread at the middle. So this is the Steinman pin. At one end, sharp end, at one end is blunt and there is no thread. So it is Steinman pin. This is bowler stirrup. Bowler stirrup, this is a device holding a Steinman pin and applying for skeletal traction. It is possible to change direction of traction without moving the pin inside the bone. This is the bowler stirrup. This is skull traction tongue used to apply skull traction in case of cervical spine injury. Skull traction tongue. This is DHS, dynamic hip screw, used for internal fixation in intertrochanteric femoral fracture or neck of femur fracture. Usually used in neck of femur fracture. This is the DHS and this is the lag screw. This is different types of DHS, 3-hole, 4-hole, 5-hole, used in neck of femur fracture. This is the cortical screw, fully threaded solid cortical screw. In case of cortical screw, in the head there is no thread, only in the shaft. Thread is present only in the shaft, but in case of locking screw, thread present in the head. This is cortical screw. This is canceller screw, half threaded cannular canceller screw. This is the plate. This is the Recon plate, non-locking Recon plate. This is the dynamic compression plate used in both bone forearm fracture. In case of radius and ulna fracture, we fix the ulnar radius by dynamic compression plate or shaft of humerus. Use dynamic compression plate. The dynamic. This is compression plate because it compresses to fracture site. This is dynamic compression plate.